Assalamualaikum. My name is Nor Maisarah, and today I and also my group members will present about what is exactly a community pharmacy. Okay, now we're gonna talk about community pharmacy based on the definition. Actually, community pharmacy are also known as a retail pharmacy is the most common type of pharmacy that allow the public to access their medication and also advice for their health. And community pharmacies are considered to be the most accessible health professional to the public, obviously, as they are available to provide personalized advice about health or medicine on a walk-in basis, and it is actually without need any of an appointment, so it is different from hospital. And when I said that community pharmacy it is the most accessible for the public, actually it was proven by a statistic shown that 89% of the United Kingdom population actually can access the community pharmacy within a 20 minutes walk. Now we know briefly about the community pharmacy. Let's move on to the roles and ethics of the community pharmacy. Okay, the first role of the community pharmacy is processing prescription. Okay, it is actually involved the checking the prescription that the pharmacy get from hot doctor and preparing the medication obviously for the patient. Okay, secondly is dispensing medications, which is it is involved the labeling the medication correctly with the instruction give for the patient about how exactly to take the medication. Actually, this is very important for us as pharmacy, give the instruction to the patient so that the patient do not take the medication wrongly. And thirdly, providing advice. It is actually very important of helping patients to understand about their health and medication and also give the appropriate advice. Then, promotion of healthy lifestyle. This is also important to spread awareness, to develop healthy lifestyle and also supporting patients to make a healthier choice of their daily, such as eating more nutritious food, exercise more often, and also stopping smoking behavior. This is important. And lastly, disposing the medication. Okay, when I talk about disposing medication, this is actually not so common in Malaysia, but some of the healthcare centers have started this action. As we know the disadvantages of the wrong way of the dispose of the medicines by taking the unneeded medication from patients and dispose in the correct and also more safely for our environment. For example, the healthcare center that have started this action, which is we have the USM hospital and also the caring pharmacy have started this action, and it actually saves a lot of money and prevent waste.
My name is Huurun Ein Arifin. For information, last month on 16 November, we went to the SuperBig pharmacy to study about how community pharmacy work. I will explain about how the community pharmacy, which is SuperBig pharmacy, manage your drugs. Firstly, registration. Each drug that have been marketed in the pharmacy in Malaysia must be registered with Drug Control Authority, which is DCA of Malaysia. So, how to recognize registered products? First, registered number, second, hologram sticker, and third, barcode. In Malaysia, registered product must begin with the letters of MAL and followed by 6 numbers and ending with letter of T or A or X or N. Each letter giving a different meaning for each products. Second is hologram sticker. As you can see from the picture, you can see that is the official hologram sticker for Malaysia. So how to identify that the hologram sticker is the real one and it's not the fake one, you can use Meditech hologram detector. The third one is barcode. You can see that from the hologram sticker, official hologram sticker, there is barcode. You can scan it through QR code scanner from application Pharma Checker. You can download it on your phone. It's available on the App Store and Apple Store. Next, I will explain about the drugs record. Each community pharmacy must record the history of patient medication and the drugs record. This is to make sure to prevent prescription order and consequence risk patients. There are two types of drugs record, which is first Group B poisons and second Group C poisons. Group B poisons must require prescription of doctors, dentists or veterinarians, while Group C poisons can be sold by a pharmacist with the detail of the purchasers and medicine recorded. So, how the drugs stored? Each drugs must be stored based on the categories of the products, which is controlled medicines and over-the-counter drugs. Controlled medicines have two types, which is poison B groups and psychotropic drugs, and poison C groups. The drugs must be organized in separate, safe and locked cabinet, especially for psychotropic and B poisons group substances and dangerous drugs. Lastly, how the community pharmacy dispose the drugs. First, they will collect the drugs, then give them to the pharmaceutical manufacturer. Then, the pharmaceutical manufacturer will follow the specific guidelines and regulations for disposal of expired drugs, contaminated drugs, and other unwanted drugs. Why we must follow the specific guidelines to dispose the drugs? This is because improper use and disposal of medications in community and hospital pharmacies led to economic losses and caused damage to the environment and society.
Assalamualaikum warahmatullahi wabarakatuh. My name is Nik Yusof. My metric number is 076519. Now I will talk about how community pharmacy buy and restock the drug. Pharmacists at retail pharmacies will restock the medicines once a week to ensure an adequate supply of medication for the community. To your knowledge, there are two types of community pharmacy, which are chain retail pharmacy and independent retail pharmacy. For chain retail pharmacy, the pharmacists are not usually involved directly in the process of buying the drug stock. The headquarters or HQ will be the one dealing with the process of buying the drug stock from the pharmaceutical manufacturers and distributing the drug stock to their outlets. The image shown above is some of SuperBig pharmacies outlets in Kelantan. On the other hand, pharmacies working at independent retail pharmacies need to deal directly with the appointed distributor regarding the drug stock, especially in restocking the controlled medication. Distributor appointed by the Ministry of Health play a significant role as third party between retail pharmacy and pharmaceutical manufacturers that produce the drug. After successfully purchasing and restocking the drug, community pharmacies have to determine the price of medication by taking several aspects into the account. The first aspect is drug cost. Drug cost is different depend to each pharmaceutical manufacturer because different research and method of drug use. Other than that is pharmacy markup. Pharmacies tend to add markup to the drug cost to cover the operational expenses involving running the pharmacy. Besides that, competition between other retail pharmacies in a particular area also influence the pricing for the pricing medication. Pharmacies may adjust the price of medication to attract customers. pharmacies also consider the different price when setting the price for the generic and brand name medication, because generic medication is less expensive than brand name medication. Lastly is government regulation. Also, pricing policy may influence the pricing of medication for the retail pharmacy in Malaysia. Now I will talk about pharmacoeconomics. Pharmacoeconomics is a branch of health economics that focus on balancing the costs and benefits of drug therapy to healthcare service, aiming at maximizing beneficial value to patients at the lowest cost. In today's healthcare settings, pharmacoeconomic analysis is used by community pharmacy to help patients receive the best care and outcome available at limited cost.
Hi, I am Nurul and I'll be talking about the procedure of purchasing medicine at a drive-thru pharmacy, which involves a systematic process that prioritizes convenience and efficacy for customers. The step-by-step procedure typically follows these stages. Upon arriving at the drive-thru pharmacy, customers follow designated lanes or signage guiding them towards the pickup window. If there's a queue, vehicles wait in line, and once it's their turn, they proceed to the next available window. At the window, a communication system such as intercom or speaker allows customers to establish contact with the pharmacy staff. They may press a button or speak through the intercom to initiate the transaction. Customers provide necessary details to the staff, such as their name, prescription number, and any additional information required for the specific medication. This information helps the staff locate and verify the correct prescriptions. Then, the pharmacist will review and process the prescription. They verify its accuracy, check for possible drug interactions, and ensure it aligns with patient's medical history. After confirming the prescription, the pharmacy staff retrieves the medication and any additional items requested by the customer. They package the items securely and hand them over to the customer through the drive-thru window. Upon receiving the medication, the pharmacy staff may provide instructions on usage, dosage, potential side effects, or any other relevant information pertaining to the medication. Customers can ask questions or seek clarification if they need it. Then, customers will provide their payment method, which can include insurance cards, credit debit cards, or cash. The pharmacy staff process the payment, ensuring that all relevant charges are accurately handled. Once the transaction is complete, customers are free to leave the drive-thru pharmacy. They can securely store their medication and follow the instructions provided for the proper usage and storage. As we all know, drive-thru pharmacies are convenient for quick pickups, especially when you're in a hurry or unable to go inside the pharmacy. But if you do, you can take a look at other health supplements that you might think necessary. You can also do some simple health checkup like blood pressure, blood glucose levels, and so on.
Hi, my name is Santhiraleka. Today I would like to explain about how the patients buy the drugs through prescription and record. Firstly, I would like to start with the definition of prescription. A prescription is a written order from a registered medical practitioner to pharmacists to compound and dispense a specific medications for the patient. Pharmaceutical products which contain scheduled poisons listed in the first schedule under the Poison Act 1952 are called as controlled medicines. The controlled medicines are categorized into Group B poison and Group C poison. Group B poison medicines used in treatment where the doctor's diagnosis is needed to recognize the symptoms. The drugs should be dispensed only against prescription. The example of Group B medicines are hypertension and diabetic medicines, which are nifedipine, olanzapine, and ramipril. For Group C poison medicines, used in treatment where the symptoms are easily recognized. The drugs can be dispensed without prescription but should be recorded in a book. The example of Group C medicines are cough, flu, and asthma medicine, which are ibuprofen, piroxicam, mefenamic acid. Next, I would like to explain about the content of the prescription. The prescription should have the patient's details, which include the name of the patient, address of the patient, and identification number of the patient. As for prescription details, it should include the drug regimen, which contain the name of medicine, dose, frequency, administration, and duration. It should also include the doctor's signature, stamp, and registration number, doctor's name and address, and date of prescribing. I would like to explain about MIMS, which also known as Monthly Index of Medical Specialties. We can access MIMS through the MIMS annual book, and MIMS also has its own app in online. MIMS help to improve patient outcomes through safe and effective use of medications. Besides that, MIMS also provides the pharmacists with both concise and comprehensive drug prescribing information in a quick access mobile format. To conclude, community pharmacies play a significant role in maintaining the health of people and also provide economic value to the country. As time goes by, community pharmacies have improved their service in line with technology development and the latest trends.